We are talking about moving vitamin D from category of vitamins to category of hormones and immunomodulators. That's how much it does in our body. So we'll talk about what is this sunshine vitamin does for us. So did you know that nearly 40% of population, when we check people in general, have insufficient vitamin D level? And here I have to say that there is a insufficiency and there is a deficiencies, and there is a normal level and there's an optimal level. So just for your understanding, we are targeting vitamin D level between 50 and 80. That would be our optimal range. If you test 30, 32, you might still show up as normal, but it's far from being optimal. The only way for us to know your vitamin D level is to test it. Unfortunately, in my experience, we see more and more of resistance of conventional laboratory testing to run this test because they're not being reimbursed for some reason. So, but that's all interesting politics. But just keep in mind, you have to be tested at least once a year. If you were found to be deficient, you need to be repleted with vitamin D supplements or sunshine, and we'll talk about it, how to do it correctly, and then retest it. If you're on vitamin D therapy, or if you're having some health crisis like pneumonia or COVID or any other situation that shake your level, potentially shaking your level of vitamin D, please retest it more frequently than once a year. So because many of us are insufficient. So today we're going to talk about what is vitamin D, why it is important, what are the concerns about low vitamin D level, how we test, and what are the optimal levels of health of tests, level of vitamin D, what is the how to optimize vitamin D level, basically how to supplement it correctly, and just few announcements about our practice. So vitamin D3 is there, or vitamin D, I should say, often called as sunshine vitamin. Vitamin D is a fat-soluble vitamin, meaning that it is need to be taken in the fat preparation or with fatty meal. And it's best known for the role it plays, not just supporting bone health, but that's probably the most common, but it's also helping absorption of calcium and phosphate in our gastrointestinal tract. So without vitamin D, we cannot absorb calcium and phosphorus or phosphates, and therefore we cannot rebuild our bones. So that's what it's probably most known for. But there is a growing body of research that shows that vitamin D is so much more than just bone health. It supports our cardiovascular health, blood sugar balance, musculoskeletal strength, so not just bones, but also muscles, neurological function, and most importantly is probably our immune function. So it impacts over 200 different genes to regulate our overall health. So the expression of these 200 genes or the silencing of these 200 genes is really important. And if vitamin D level is low or insufficient, as we learned, those 200 genes do not function properly. So vitamin D plays a role not only in the bones and teeth of our body, but also, as I said, musculoskeletal health, brain development, mood and mental health. Many of us probably familiar with their seasonal affective disorder, when we don't get exposed to sunshine and the vitamin D level drops and we becomes more depressed or more feeling gloomy and doomy. That also is vitamin D level function. Cardiovascular health is so important in vitamin D is so important for cardiovascular health. So remember that. Respiratory health, mostly with immune system. Gut barrier function, that's actually where vitamin D keeps our gut lining cells stick together. So preventing their leaky gut syndrome. Metabolic health, specifically the glucose metabolism, is another very important function of vitamin D. And of course, immune system health and function. So vitamin D, especially on the immune function, we want to dive into it a little bit deeper. It helps to regulate our immune system because it stimulates or it upregulates our T regulatory cells. Those are the white blood cells that help balance our immune system. So if we are too low on vitamin D, we're more prone to not respond to infections as efficiently as if our level is high and normal. And we are much more prone to develop autoimmunities if our vitamin D level is low. So for people who have any autoimmune disorders, vitamin D level should be on the higher normal range, 70 and 80. And that's why but if we are dealing with infections, you probably know my protocol that I recommend for my patients to take 50,000 units of vitamin D on the moment you feel like you're getting sick, because that will stimulate our innate immune system through the regulatory T cells, and our white blood cells will be working much more efficiently, addressing the pathogens in the body. Vitamin D is also very important for rebuilding our glutathione level, which is the master antioxidants, intracellular and extracellular antioxidants that protects not only our cells from damage, it also helps our cleaner cells to clean up their tissues and battlefield, as I call it, when their white blood cells come and start destroying the pathogens and spray the bleach and spray their hydrogen peroxide on their pathogens, it creates a lot of damage. So glutathione is so important to clean it up and reduce that fire in the tissue. So vitamin D, again, is extremely important for proper function of these vital antioxidants, glutathione. As I mentioned, it tightens gap junctions in the intestinal lining and therefore provides a stronger gastrointestinal barrier and protects our body and our immune system from the gut level. It supports a healthy inflammatory response. It also, the higher blood level of vitamin D enhances our immune function and soothes tissue of the gastrointestinal tract. So overall, vitamin D is really, really essential. So where do we get vitamin D? Believe it or not, we actually can make vitamin D in our skin. However, it's not that we are producing it by looking at the sunshine. We need to expose our skin to the sunshine, okay? And we need to be literally naked, maybe in the bathing suit, for 20 minutes before 11 o'clock is ideal, when the sunshine is not so angry and not so harmful for us. And then you should not take a shower for 1 hour. So basically what happens is the sunshine, the UV light, will stimulate the vitamin D production in our skin. But then if you wash off the sebum or the oil on the skin, that process ceases. So you cannot take a shower after vitamin D exposure. When do we get this opportunity? Maybe when we're on vacation. Maybe when we're on our beach or on the resort, we can bathe in the sun and then not to take a shower and wait, right? Doesn't happen in our modern urban life. Even if we exposed a little bit during our run or just walking in the park, we run home, we take a shower, boom, the whole process of vitamin D production by your own body is stopped. So that's why many of us and all of us, unless you are working in your garden in the morning and you don't have to take a shower right away, we all need vitamin D supplementation. Well, during the winter time, when we are not exposed to sunshine, if we live in the northern hemisphere, you probably can take UVB light therapy, but it should be done under clinical supervision. Some dermatology offices will have UVB light therapy, very widely used in the treatment of variety of the skin disorders. But of course, there's a dietary sources of vitamin D. And there's a fortification of some products with vitamin D as well. So if you decide to supplement vitamin D, please choose vitamin D3 because this is an active form. And this is the form of vitamin D that is derived from lanolin in the sheep's wool. I actually didn't know that recently. I just learned that. So it's not synthetic. It's actually a natural source of vitamin D3. For many years, conventional doctors, when they detect vitamin D deficiency, they would prescribe vitamin D2, which is derived from mushrooms and other fungi, and that have been exposed and stimulated to ultraviolet light. But it is not active form of vitamin D, and therefore it cannot be, some people cannot convert D2 to D3, and therefore. So if you choose to supplement, please request vitamin D3. It's also very important for adequate function, absorption, and activity of vitamin D is to have an adequate magnesium level. So please make sure your practitioners will also check your magnesium level. And if it's low, please supplement it. Otherwise, your vitamin D level will not go up. So here's the sources of vitamin D from the food: fish, salmon, trout, halibut, tuna, mackerel, sardines, eel, caviar, of course, a great source of vitamin D3, and cod liver oil. Also, some other products like eggs and egg yolks can have some amount of vitamin D3. Whole dairy, raw specifically, but we're hardly exposed to raw dairy, and cremini mushrooms because they're UV exposed. And cremini mushrooms are those beautiful mushrooms that you can buy in some of their stores. So that it's, as I mentioned earlier, it is so important to test vitamin D level. There's no other way for us to find out if your vitamin D level is adequate, but just testing it. So the storage level is tested by measuring a specific vitamin D derivative, which is 25-OH D level or 25-hydroxy D level, not the 125 hydroxy vitamin D. So the Vitamin D Council suggests the ideal functional range or level of vitamin D in the blood between 50 and 80 as an ideal vitamin D level for optimal health, and generally recommended that adults take 5,000 units per day. Some people need more, especially if they're deficient. We also, beside oral form of vitamin D, we offer injectable vitamin D level for people who have a difficult time to absorb vitamin D or who need it in the loading dose. So please remember that. So the levels below 20 or 30 in the blood test considered functionally suboptimal, even though in some labs it will show up as normal. It will most likely require vitamin D supplementation. But if you notice that vitamin D level are higher than 100 nanograms per milliliter, it's considered to be excessive. I don't see a lot of it, maybe once or twice, and all you need to do is to stop vitamin D for at least a week, and then go back to your 5,000 unit supplementation. So the vitamin D deficiency causes and risk factors would be, of course, insufficient sun exposure, which we all have, or spending too much time indoors, which we all have. Living in the northern region of the United States, Canada, or Europe, people with the darkest skin, especially when they're living further away from the equator, will have a lower vitamin D levels. The darker your skin, the more sun you need to get the same amount of vitamin D as for example, fair-skinned people. And this is, of course, evolutionary developed, so we don't, we adapt to our environment. Some medications, such as oral contraceptives, corticosteroids, calcium channel blockers, or medication that block acid production in our stomach, will also predispose us to the vitamin D deficiency. Some other deficiency risk factors would be women when they're pregnant. It has to, the women, when all pregnant women should be supplemented with at least 5,000 units of vitamin D. When we are stressed, we need more vitamin D. And some other chronic conditions such as obesity, diabetes, chronic kidney disease, inflammatory bowel disease, and malabsorption will be a risk factor for vitamin D deficiency. Autoimmunity, any autoimmune disorders, is considered to be a chronic condition, and vitamin D needs to be monitored closely. Of course, sedentary lifestyle or insufficient exercise and exposure to sunlight, and low magnesium. Remember that magnesium is really important for the absorption of vitamin D from our gut. So symptoms of their vitamin D deficiency would be fatigue, weakness, anxiety, depression, mood swings, poor memory or difficulty concentrating, excessive thirst or increased urination, frequent infections, because remember, vitamin D affects our immune system and how rapidly we respond to infections, joint and bone pains. Vitamin D will affect the calcium level and phosphorus level, so we need it for the stronger and healthier bones. And in children, when they're chronically deficient in vitamin D, muscle weakness, delayed growth, and rickets. But we don't see that a lot, luckily. On the other hand, the toxicity of vitamin D, when the vitamin D can be harmful, usually happens when people take excessive doses or high doses for more than 3 months or longer. Or they take a very, very large one-time dose, more than 3,000 units in the 24-hour period. But that's rarely happen unless there's a poisoning. When you 25 hydroxy vitamin D level in the blood is too high, then it could cause high level of calcium in the blood, and that can create the conditions called hypercalcemia. So the toxicity symptoms actually could be very similar to deficiency: feeling sick, confused, tired, poor appetite, feeling very thirsty, passing urine often, constipation or diarrhea, abdominal pain, muscle weakness or pain, and bone pain. The same symptoms. So test your vitamin D level regularly. So let's talk about the case of chronic fatigue. So here's a 45-year-old female that is complaining of fatigue, dry eyes, and constipation. Patient is successful businesswoman and often spends long days at the office, skipping her daily exposure to sunlight. Until a couple of years ago, it didn't interfere with her energy level. However, after she got her mastitis several times after her last child, she has noticed an increase in her fatigue and the brain fog. She reports taking broad-spectrum antibiotics 2 times within the 4 months of breastfeeding her last child. So when she came to us, we put her on the nutrient support for mitochondrial function. Due to this relentless fatigue, we have several products that support the mitochondria. Some of them are Powerhouse, Multi. Those of you who know this product, it's a great mitochondrial support, or ATP 360, another great product for mitochondrial support, or urolithin A is another wonderful product. So due to her use of antibiotics in the recent months, we also put her on their program to restore her normal intestinal function and adding the gut healing supplements. That includes glutamine powder, probiotics. And she was scheduled for testing. Of course, her symptoms of fatigue, mental fatigue, and physical fatigue and will make us think about the thyroid function. So we ordered thyroid panel. We ordered autoimmune markers, anti-nuclear antibodies, that is called ANA, vitamin D, as well as food sensitivities, and organic acid test. Those two last tests probably not going to be available in your regular doctor's office, but we run them here at the functional medicine office. So those are considered to be functional medicine tests. So this is their the nutrients that will be in their product that I just mentioned. There will be definitely omega-3 fatty acids, which include inflammation and help with their energy production, probiotics, multivitamin, and the patients would always get homework. So she received some homework to understand how immune system function works and how she can affect her immune system function by changing her lifestyle, how her energy is being produced, and how to reduce the stress. And we scheduled the lab work. She was recommended to eat Mediterranean diet that is so anti-inflammatory. So 30 days later, she returned, and we learned that her thyroid function was completely normal, but she did have some food sensitivity. She had moderate to severe reaction to milk, rice, wheat, and eggs, which is not so uncommon. Those are probably most common foods that we have to eliminate, for our patients to feel better, at least temporarily. She didn't want to follow recommended paleo diet, so she just eliminated those foods. And sometimes people are ready to do whatever we tell them. If we say, let's do elimination diet for 6 weeks, 50% of the patients say, yes, I'm ready to do that. I'm motivated. And 50% people say, you know what? It's really hard for me to give up my wheat. And I was actually one of those people when I started my journey in functional medicine and people around me were all gluten-free. I said, I don't have any symptoms. I don't need to stop eating gluten, such an inflammatory food for all of us. But then I ran food sensitivity test. And guess what? I had a severe sensitivity to gluten, dairy product, and eggs. So I had to lay it off. So sometimes food sensitivity test is a really nice compromise. Of course, it costs more money, but sometimes people are ready to invest to understand what food they should absolutely stay away from. So due to her low vitamin D level, which was below 20, now you know it's really low, the higher dose were recommended until the level normalized. And we will retest in about 6 weeks. The way we load vitamin D is we give 50,000, not 5,000, but 10 times of that for about anywhere from 3 to 7 days, depending on the level where we start. And then we'll park people on 5,000 units per day, and we'll retest in 6 weeks. And so we did it for her. According to her organic acid test, which is another functional medicine test that looks at the processes inside of the cell, she had some imbalances in her B vitamins. And she was supplemented with B vitamins. B vitamins are so important for our brain function, for the energy production, for detoxification, for basically every process in our body. And interestingly enough, she had markers for autoimmunity, that positive anti-nuclear antibodies, ANA, was pretty high, 1 to 320. And she didn't know that she has non-specific markers for autoimmunity. A lot of people will come and ask, what does it mean? And unfortunately, in conventional medicine, they say, well, that's a non-specific marker. It could be elevated without really any autoimmune issues or autoimmune disease. But in functional medicine, this is a huge red flag for us. This is their early call that body is going through immune system dysregulation. So we do not leave positive ANA unchecked. We need to work on it. And people do convert from from positive to negative if we remove the root cause of this marker to be elevated. So we changed her protocol to give her a little bit more of their gut support in the form of L-glutamine, which is amino acid that basically seals the gut barrier. We gave her some immunoglobulins to help her gut to function better. And of course, we gave her loading dose of vitamin D. And remember, vitamin D is so important for tightening the gap junction in the intestinal lining. It will seal the gastrointestinal barrier and will protect and stop the progression of autoimmune disorders. And as we mentioned earlier, the higher level of vitamin D have been shown to enhance immune system and soothe tissue of the gastrointestinal tract. We also gave her a little bit of N-acetylcysteine to support her detoxification and glutathione production, as well as activate her T cells. We gave her antioxidant alpha-lipoic acid, acetyl L-carnitine, B complex, zinc, and again, we were teaching her and we're giving her more homework so she can understand how her immune system functions and what she needs to do and why it is so important to balance the gut for properly functioning immune system. And again, she trusted us finally, and she began that paleo diet with appropriate elimination of food that show up positive on her food sensitivity test. So after 8 weeks, she did improve her vitamin D level. And so we reduced her supplementation from 10,000 to 5,000, but her ANA did not really improve. So it did not improve, and it actually went up. And she still experienced some fatigue. So at that point, when her ANA increased, we said, okay, so she's fighting some infections most likely. And maybe those infections are viral in her body in general, like Epstein-Barr virus or a variety of their herpes viruses, like human herpes virus 6 or CMV virus. So we have a whole viral panel, and we suspected that her gut needs more support. So we provided all of that, and in 8 weeks after that, she came back with her vitamin D level increasing from 20 to 65. Now she's in optimal range. And actually her ANA became negative. And this was the first time since her diagnosis. And her symptoms of fatigue improved significantly. And she's still a young mom with 2 kids. And as you mentioned, she initially presented with vague symptoms of fatigue, which could indicate a variety of things, right? Lack of sleep, she's a new mom, could be thyroid function, magnesium deficiency, could be anemia and iron deficiency, could be mitochondrial dysfunction, could be chronic infections. So the reasons for these non-specific symptoms of fatigue is multitude. We in functional medicine need to really dig deeper and check all those possibilities to help our patients to feel better. So for her, we rule out thyroid dysfunction. We checked organic acid test, vitamin D level. We determined that she does have some autoimmunity or beginning of autoimmunity. And most importantly, vitamin D level was low. And we supplemented that. And as I said, vitamin D is really essential vitamin. Make sure you check your vitamin D level. If you weren't checked in the last 6 months, ask your doctor to check your vitamin D level. We're producing it in the sun, but unfortunately, because we're not exposed to so much sun, many of us are vitamin D deficient. And now when I see my patients in Florida, believe it or not, many of them are deficient as well. Because what were we taught for years and years and years? Make sure you put sunblock, which is true. It's very important, especially if you are planning to be exposed to sun in their later hours of the day, anywhere from 11 to 4, and use sun tanning, you need to apply sunblock. But we still need to get that 20 minutes ideally early in the morning. So it's a main source, sun is main source. Because of we are getting less and less of it, we need to supplement vitamin D. So when we check vitamin D, make sure we're checking 25 hydroxy vitamin D and supplement according to the guideline. And you can read about the guideline on the vitamincouncil.org and look for vitamin D deficiency there. So for many of you who are new to my practice, what would be the next step for you? If you're interested to work with a functional medicine doctor and you in New York or in the tri-state area, please call us and we'll be happy to walk you through the process. If you're not in New York, go to their ifm.org website where you can find a functional medicine doctor near you. We now have functional medicine practitioners not only in the United States, but also abroad, in Europe, in Asia, in Africa. Everywhere in the world now we have functional medicine doctors. So please look at your area and find someone you can build a good rapport and continue to work with. And today, because we're talking about Sunshine Wellness, we want to offer you a 15% off on the Wellness Trio, which is their wonderful protein shake, would consist of pea protein as well as the multivitamin. So that's the best breakfast complete. And Dr. Elena vitamin D3 and K2 boost, which is a great vitamin because it, along with the D3, that helps us to absorb calcium from the gastrointestinal tract. It also helps to deposit this calcium into the bone. That's the specific function of vitamin K2, that will take the calcium and deposit it into their bones, not into their coronary arteries of your heart or in your aorta or in your arteries. So vitamin K, especially if you take vitamin D on the long run, long term, you need vitamin K as well, which is another fat soluble vitamin. We might talk about it in one of the next sessions. For children, I recommend, or even for adults, when you need to dose your vitamin D level in a higher range, we also offer liquid vitamin D3, where 1 drop equals 1,000 units. So if you need 5,000 units, you just put 5 drops into your morning shake or just in your mouth. If you need a higher doses, it's much easier to dose this preparation than their preparation in the capsules with vitamin K. So as I mentioned, my antiviral protocol includes 50,000 units of vitamin D3 for 3 days in a row. And that's usually when it's easier to dose with the liquid vitamin D3 of 1,000 units per drop. So use the code Sunshine15 to get a really great saving from my e-store. And also, of course, our essential B complex, super omega 3, and glutathione precursors are the great trio that everybody needs in their supplement closet. We use the supplements, if not daily, at least on as needed basis. Great trio as well. And you can also enjoy 20% off of your 6-biotic and GI support. So 6-biotics is a great, very versatile probiotic that offers 6 different probiotic strains. All of them had clinical research behind them. It's probably one of my favorite probiotics. And there's 6 probiotics and 1 fungus, which is Saccharomyces boulardii, excellent probiotic to protect your gut from a variety of their invaders. GI support is a great protein shake. It's a medical food that helps to heal our gut barrier and support it and protect from leaky gut. So great 20% off on this supplements. And remember about whole gut wellness program. If you are new to our practice, and you don't want to, if you're not ready to work one-on-one with me or with other practitioner, this is a great way to get introduced to functional medicine. We are offering 4 hourly sessions, weekly sessions with our 4 practitioners, including myself, if you purchase this whole gut wellness program with clinical support. This is the program that teaches you everything, or everything that we know and we want you to know about the gut. And it focuses on the balancing gut health and explains how gut health will affect the overall well-being. So if you're interested, look into that. And there's a promotional code for that program that will teach you about for our strategy, gut-brain axis, detoxification function of the gut and the liver, and you can use $50 off if you enroll now. And here's their QR code that you can scan and get this program going for yourself. Excellent place to start your education in functional medicine. So excellent gift for someone who is interested in functional medicine. So, and if you want to join our Instagram broadcast by scanning this QR code, you can join us as well. Just to remind you that we offer a variety of the services in our office. One of them is IV therapy. For those of you who never experienced it, it's a great way to bring yourself back from fatigue, from post-viral syndrome, to get high dose of vitamin C, or get detoxification boost, or ageless infusion that we're now offering in our office. And for those of you who are already the patients of our practice, on June 16, we have our traditional 3x4 support group that is led by Marina Kucher, who is our functional medicine practitioner and genetic expert. So this test helps our patients to learn about themselves, and it's a great way to understand why certain supplements should be taken for a lifetime if you want to support your genetic vulnerabilities. And if you have any friends in Florida, make sure you tell them that we are there now as well on Sunny Isles. I see patients there in person every 2-3 months, but otherwise we start helping these people through their telemedicine. And so if you have friends who want to become our patients, please refer them. We would be really grateful. But you can scan this QR code and refer your friend. And thank you so much for joining today's program. And please keep an eye on our announcement. We will have another lecture in July, I think, or in August. So we'll announce their topics soon. And as a thank you for joining our live Q&A today, we're happy to offer you June QA10, which will give you 10% off site-wide discount.